So today we're going to discuss traumatic brain injury in students. You might be asking, why is this important? Well, traumatic brain injury, or TBI, can occur for a variety of reasons and at any point in life. Therefore, there's a high probability that a teacher will have a student with a brain injury in the classroom at some point in their career. Due to this, teachers of all age groups should be prepared in how to identify and address the needs of students with a TBI. So, what exactly is a traumatic brain injury? Well, according to the Centers for Disease Control and Prevention, TBI is caused by a bump, blow, or jolt to the head that disrupts the normal function of the brain. TBIs can occur for a variety of reasons, such as falls, car accidents, sports injuries, collisions with objects or other people, or being shaken, such as may be the case with a younger child or an infant. Injuries can range from mild to severe. The most common type of mild traumatic brain injury is a concussion. A more recent notable case of a severe TBI occurred in January of 2011 when Congresswoman Gabrielle Giffords was shot in the head. Despite all the odds, though, she survived the attack and returned to the House of Representatives in August of that year before she resigned in January of 2012. There are approximately 1.7 million cases of traumatic brain injury each year. It is a common cause of acquired disability during childhood. Not only does it result in disability, but it is also a leading cause of death in childhood, resulting in approximately 435,000 emergency room visits and 37,000 hospitalizations annually. While all age groups are at risk for TBI, school-aged children and young adults are mostly affected, with children under the age of 5 years being at a higher risk of receiving emergency care or hospitalization than older children. Some symptoms of TBI may include headaches, confusion, lightheadedness, dizziness, blurred vision or tired eyes, hearing loss to include ringing in the ears, a bad taste in the mouth, fatigue or lethargy, a change in sleep patterns, behavioral or mood changes, and trouble with memory, concentration, attention, or thinking. Some additional symptoms may include communication and fine motor skill deficiencies, difficulty with organizational skills. A child may also no longer be able to perform at a high level that they once could. They may have difficulty processing new information, and unlike a child with a learning disability, who typically shows consistent overall patterns of difficulties in school, a child with a TBI may perform well in one area but poorly in another. Also, a child may not even realize that they've lost certain skills or abilities, and they may continue to use learning strategies even though they are no longer effective. One of the main complaints from families and children with the TBI is that behavioral issues and problems adapting to changes seem to be the most aggravation in adjusting to life with a TBI. So, how exactly are traumatic brain injuries diagnosed? Well, TBIs are typically diagnosed using multiple assessments to determine the extent of the injury and associated deficits. These assessments should be administered by a licensed school psychologist, a psychologist licensed by a state board of psychological examiners, or other individuals who have the training and experience. Assessments typically measure behavior, cognition, memory, attention, abstract thinking, judgment, problem solving, reasoning, and information processing. One type of assessment is called the ABC assessment, which stands for Antecedent-Behavior-Consequence. An antecedent is the events, actions, or circumstances that occur immediately before a behavior takes place. The behavior is what the child then does, and the consequence is what occurs immediately after the behavior. It is important to ask questions such as where, who, when, and what relating to the antecedent. It is through these variables that changes can start to be made to modify behavior. The behavior changes take place for one of 4 reasons. It is typically to either gain attention from an adult or a peer, to try and get away from someone or something, to obtain some sort of tangible reinforcement such as food or possibly a token or a prize, or to gain sensory stimulation or relief. So an example of an ABC might be, the antecedent would be that the teacher announces that it's time for reading. The student's behavior is that they then tell an inappropriate joke. The consequence is that the peers laugh and class is disrupted. So in this case, the student would be possibly either looking to escape the task of reading, or they may be trying to get attention. So it is through the use of ABC assessments that the reasons for the child's behavior can try and be determined in order to create interventions that will be effective. So some accommodations, modifications, and strategies for children with TBI include 504 plans or individualized education programs. A 504 plan comes from the Rehabilitation Act of 1973, Section 504. This section applies to students who have a physical or mental impairment that substantially limits one or more major life activities, including learning. A 504 plan would be for a student that is in need of some sort of accommodation in the classroom, but they do not require special education services. So therefore, the requirements for implementing a 504 plan are not nearly as specific as they are with an IEP. However, if the student has one or more of the 13 specific disabilities listed in the Individuals with Disabilities Education Act, or IDEA, then an IEP will need to be implemented. Even though there are many similarities between 504 plans and IEPs, such as the need for both of them to be reviewed annually, there are also several differences. The team members that determine a 504 plan are not nearly as specific as with an IEP team. A 504 team may consist of the student's guardians, general and special education teachers, and the principal. Unlike an IEP, it is not a requirement that a 504 plan is a written document, although it can be helpful. A 504 plan addresses accommodations and services that are being provided for the student, who will be providing those services, and who is in charge of implementing the plan. Another notable difference is that with an IEP, parents or guardians must be notified in writing before any changes are made to services or placements, and that if the guardians choose to disagree with the changes, that they have the right to continue those services until an agreement is made. This is different from a 504 plan, which does not require prior written notice for guardians. They only need to be notified in some form that changes are being made to services or placements. It's also important to note that even if a 504 plan or an IEP is not needed for a student right away, it may still become a necessity in the future should the student's needs change. This is important to note because with a traumatic brain injury, sometimes symptoms do not occur until up to 6 months after the event happened that caused that TBI. So even though after student is in some sort of accident or something occurs that would cause the TBI, they might be fine for those first few months until those symptoms finally start to show. So there are many accommodations and strategies that can be used in the classroom. One of the issues or symptoms with a TBI is that the student may have issues with attention and concentration. So some accommodations to address these concerns would include the removal of unnecessary items from work areas to prevent distractions. The teacher can also break work up into more manageable sections, or ask the student to give a verbal summary of information to check for understanding. It may also be important to use verbal and nonverbal cues to signal the student that he or she should be paying attention. Some memory strategies include having the student frequently repeat information and summarize it. Utilize post-it notes, calendars, or assignment notebooks that the teacher can check to make sure that the information is correct. It's also recommended that students use labels, icons or pictures, or planners to help remember information. Students can also be taught how to chunk information to make it easier to remember, or use techniques that can aid the student in remembering information, such as acrostics or acronyms. It is also important to make connections between the student's prior knowledge and new information, and provide presentations of instructional materials in which the student can learn by doing. Some strategies to assist the student with following directions might include giving visual and verbal instructions, having the student repeat instructions, noting specific parts of instructions that the student should pay particular attention to, simplify complex instructions, and keep instruction at a manageable pace for the student to follow. It is also suggested that when giving directions, to ask the student to perform the task, check for accuracy, and then provide immediate feedback. Some strategies for organization include giving students time to review their work, provide students with a checklist of steps that they can mark off as they work toward completing a task, provide students with a schedule of daily routines, which could be adhered to the student's desk to be referred to at any point. Give students written instructions for organization, such as putting all completed assignments on the right side of the folder and uncompleted assignments on the left. Provide an outline of the lecture for students to fill in notes as they go, or have students use color-coded materials for different subjects, or enlist students in helping organize a class party or other activity to work on their organizational skills. Some effective teaching strategies include the use of effectively stated requests or precision commands. This strategy consists of steps to prevent escalation of behavior problems by giving clear instructions, allowing the student a chance to comply without interrupting, and then reinforcing the student to follow a request promptly. It is also important to teach students self-monitoring strategies, such as recording their own behavior to make them aware of their own actions. When these strategies are not effective, then interventions need to be in place to teach students how to replace questionable behaviors. After a brain injury, it is also important to provide students with positive reinforcement that can make the return to school more rewarding. This may consist of praise or other forms of social reinforcement, such as points that can lead to prizes or other tangible reinforcers. Another strategy would be the use of behavioral momentum. This strategy involves making a request with which the student has a high probability of compliance before making a low probability request. Other accommodations or modifications that can be made would be transcribing textbooks into audio format, discussing accommodations with students prior to class, repeat instructions as necessary, and keep them brief. You might also want to assign other students to be note takers, and make sure the students are made aware of all requirements and important dates of exams and assignments. It is also important to give students plenty of notice if any changes are going to be made to the syllabus. Other modifications or accommodations would be allowing students the use of headphones or earplugs to minimize distractive noises. And students may also need to be given an area to retreat to if they need to remove themselves from overstimulation. Students can be supplied with large print books or audiobooks. It is also important to make modifications to allow students additional time for quizzes or exams. And exams should be made multiple choice rather than written format. If students are required to complete written work, then the amount of work should be decreased. Prior to giving students exams, the teacher can also provide study guides or review sheets. It is also important to take into consideration the physical arrangement of the classroom. This may include seating the student closer to a teacher or a helpful peer. If the student suffered other injuries in addition to the brain injury, resulting in temporary or permanent physical needs, then additional arrangements may need to be required, such as putting more spacing between desks. For students required to move from classroom to classroom, as is typically the case at secondary levels, students should be allowed some additional time to move between classrooms. The use of technology can also be integrated into the classroom to assist students with a TBI. It is recommended to use visual aids such as PowerPoint, overhead displays, or a smartboard to present lecture information. Students can be provided with access to videos demonstrating classroom activities and computer-generated diagrams. Lectures can also be videotaped and posted for students to view as needed. It is also important to provide students with materials such as tape recorders, calculators, electronic spellers, computers or word processors, communication devices, timers, alarms, and beepers or equipment for mobility. Laptops or tablets could also assist students with note-taking, organizing information, or reading text out loud. So in addition to a 504 plan or IEP, other resources and services are available to students and guardians. Most schools have guidance counselors that can either assist students or guardians with questions or put them in touch with the correct person. Schools may also have disability services departments that can assist students where needed. Many schools also offer centers for writing or math that students can go to for assistance. Tutors may be available before or after school to assist students with schoolwork. Resources available to teachers may consist of coworkers that previously had a student with a brain injury. There are also many online resources available to teachers, such as the Learning Disabilities Association of America website, which addresses topics such as memory and functioning. This website can also be a useful resource for guardians, since it provides links to other websites about disabilities and the U.S. Department of Education, which provides additional resources and information for guardians. So as I mentioned earlier, it can sometimes take up to 6 months for disorders or symptoms to occur after a TBI, making it imperative that after an event likely to cause a brain injury, factors that lead to behavioral problems are documented. For this reason, teachers should be aware of the signs of a potential TBI in order to refer a student for an assessment. Teachers should also be aware of effective teaching strategies and how to make modifications and accommodations for a student once they've been diagnosed with a traumatic brain injury. Making students knowledgeable about strategies and skills that they can use will help a student with a TBI continue to be successful both in and out of school.